All praise and glory to Yahweh Bashem, Yahweh Shai. Double honors to the apostles of GMS who taught me this word. I'm your host, Sakaran, and welcome to my Hang Esau on the Gallows page. Doing the work of a watcher and paying attention to prophecies, alright, as usual. Now, I ran across this article today on RT, and it said that pretty much I'm gonna read the title to the article. It says White House wants $1.2 billion to fight antibiotic resistant bacteria looming superbug epidemic. Okay, and they've been finding these superbug epidemics or superbugs in different places. You know, Britain, in Brazil, you know, and here in America, and you know they're calling it an epidemic, man. You know, and now I believe the word epidemic. Yeah, so what we're gonna do is go to the exact definition or etymology of this word epidemic. All right, to get the definition of it, and it says epidemic, early 17th century, as an adjective from French, epidemique, from epidemie, via late Latin from Greek epidemia, prevalence of disease, from epidemios, prevalent, from epi, which means upon, I'm trying to click it but it's not, upon, and demos, which means people. So upon a disease, upon the people, you know, and that's what an epidemic is. So you know when you got you know you know a couple of people infected with the same disease, you know, and in this case these are diseases that they are resistant to antibiotics, no matter what the hospital or the doctor give them. The superbug or bacteria just keeps on multiplying and growing, right? And it reads, the White House has called for increased investment to fight antibiotic-resistant bacteria to prevent resurgent diseases once thought eradicated, and new superbugs that similarly gain strength thanks to the modern penchant for prolific antibiotic use. President Obama will ask the U.S. Congress to nearly double funding that combats antibiotic resistance to $1.2 billion, the White House announced Tuesday, calling the matter one of the most pressing public health issues facing the world today. The announcement was a follow-up to an executive order the president signed in September that launched efforts against antibiotic-resistant bacteria. Now let's get that executive order. All right. And it says executive order combating antibiotic-resistant bacteria. Executive order combating antibiotic-resistant bacteria by the authority vested in me as president by the Constitution and the laws of the United States of America. I hereby order as follows. Section 1. Policy. The discovery of antibiotics in the early 20th century fundamentally transformed human and veterinary medicine. Antibiotics save millions of lives each year in the United States and around the world. The rise of antibiotic-resistant bacteria, however, represents a serious threat to public health and the economy. The Centers of Disease Control and Prevention, CDC, in the Department of Health and Human Services, estimates that annually at least 2 million illnesses and 23,000 deaths are caused by antibiotic resistant bacteria in the United States alone. Detecting, preventing, and controlling antibiotic resistance requires a strategic, coordinated, and sustained effort. It also depends on the engagement of governments, academia, industry, healthcare providers, the general public, and the agriculture community, as well as international partners. Success in this effort will require significant efforts to minimize the emergence of antibiotic resistant bacteria, preserve the efficacy of new and existing antibacterial drugs, advance research to develop improved methods for combating antibiotic resistance and conducting antibiotic stewardship, strengthen surveillance efforts in public health. Now, did you catch that? Strengthen surveillance efforts in public health and agriculture. Now, how would that come about? Well, the RFID chip is one, all right, and them constantly monitoring farms, and things of that nature. Anybody, that deals with food and things of that nature, it's part of the New World Order. They pretty much for them to take control of all these things, you know. This is just a vice for them to get more control over these things, over these resources. All right, develop and promote the use of new rapid diagnostic technologies. Accelerate, develop and promote the use of new rapid diagnostic technologies. What comes to mind? The RFID chip comes to mind, because with the RFID chip, it will allow your health stats to come right up, because the RFID chip is in a person, you see, and it got the stats, and they got the it's monitoring the heart and your blood pressure and all kind of things, man. To let the doctors know right away what's going on with you. Okay. Accelerate scientific research and facilitate the development of new antibacterial drugs, vaccines, diagnostics, and other novel therapeutics. Maximize the dissemination of the most up-to-date information on the appropriate and proper use of antibiotics to the general public and health care providers. Work with the pharmaceutical industry to include information on the proper use of over-the-counter and prescription antibiotic medications for humans and animals. And improve international collaboration and capabilities for prevention, surveillance, stewardship, basic research, and drug and diagnostics development. The federal government will work domestically and internationally to detect, prevent, and control illness and death related to antibiotic resistant infections by implementing measures that reduce the emergence and spread of antibiotic resistant bacteria and help ensure the continued availability of effective therapeutics for the treatment of bacterial infections. So with these superbugs, they could use this as an excuse to bring in the RFID chip. Now, let's read on. Okay, so it says we're here, right? It says the proposal called for funding research into new antibiotics, increased monitoring of infection outbreaks, new resistance efforts at veterans and military hospitals, and efforts to curb antibiotic overprescription. It says read more. New antibiotic found in grassy field proves effective against drug-resistant bacteria. Now let's see. Now, it had mentioned CDC and these different things. Now we know that the CDC, all right, has in their possession all kinds of bacteria, all kinds of diseases, old and new. They constantly are mutating these diseases and making hybrids of these diseases, and they try to say it's for the benefit of the public, for ways to combat these diseases. No, what they're doing is actually giving people the diseases, you know, like the flu, you know, H1N1 and all these other different things. And but we know, according to the scriptures, there's gonna be you know, this superbug thing is real because it is in the scriptures. You know, there's gonna be these, you know, like pestilences, you know, worse than AIDS, epidemics worse than AIDS and stuff that are going to be spread upon the public via by way of air, food, you know, or water. All right, or by way of human, you know, from human to human. You know, cross contamination. You know, with foods and things of that nature. You know what I'm saying? Because these are the times we're living in. These are the signs of the end. Now, these things are in the Bible. They're known as pestilences. Now, what is a pestilence? Pestilence, it says, right? A fatal epidemic, right? Epi meaning upon, and demic the people, upon the people. A fatal disease upon the people, especially bubonic plague. Okay, so um, that's what the word pestilence mean, a disease, you know, and diseases are caused by bacteria, you know, and in this case, they're talking about bacteria that cannot be cured, you know,